If you've ever worn a bandage that left a red painful mark on your skin or a patch that left behind a gooey mess, you know how important the right adhesive can be. In medical and cosmetic applications, choosing a safe, skin-friendly adhesive is about both the safety and the comfort of the user. The adhesive has to perform some function, but it shouldn't cause unnecessary harm or irritation while doing so. In this video, we will explore which adhesives are typically used for stick-to-skin applications, the standards and requirements they must meet, and how to choose the right adhesive based on various factors. When choosing a stick-to-skin adhesive, several essential considerations ensure both effectiveness and patient safety. Bonding strength is one of the most critical factors, as the adhesive must hold securely while still allowing for safe removal without causing skin damage. This is particularly important for patients with fragile skin, such as the elderly or those with conditions like diabetes. Second, breathability is another key factor, since adhesives that do not allow airflow or moisture control can either dry out the skin or cause excess hydration, leading to irritation. Third, chemical composition also plays a vital role, as adhesives must be biocompatible to avoid allergic reactions or harmful interactions with the skin. Finally, the weight of the device or dressing being supported by the adhesive must be taken into account, as heavier applications can reduce wear time even if the adhesive is rated for extended use. These considerations together ensure that the adhesive not only performs well, but also protects the patient's skin throughout its intended duration. Several types of adhesives are considered safe for human skin, each offering specific advantages depending on the application. Acrylic adhesives are widely used for wearable devices and tubing because they provide strong bonds capable of supporting weight. Silicone adhesives are gentler and often used when repositioning or sensitive skin is a concern, making them suitable for applications that prioritize patient comfort. Natural rubber adhesives offer strong adhesion but are unsuitable in medical environments due to latex content, which poses allergy risks. Lastly, synthetic rubber adhesives, on the other hand, are durable, resistant to UV light, and able to withstand high-temperature sterilization, making them useful in more demanding environments. Ultimately, the best adhesive depends on the intended use, wear duration, and patient needs, which is why prototyping and testing under real conditions are essential to selecting the right solution. Skin adhesive products must follow strict requirements depending on whether they are intended for cosmetic or medical use. Non-medical products in the US generally do not require FDA pre-market approval, but medical-grade products must undergo rigorous testing. Biocompatibility standards are central to this process, as they determine whether the adhesive will irritate the skin, harm cells, or cause allergic reactions. Labels such as hypoallergenic may be sufficient for consumer-grade items, while medical-grade adhesives must pass more stringent evaluations. Relevant standards include ISO 10993-10 for irritation and sensitization, ISO 10993-5 for cytotoxicity testing, USP Class II special controls, which regulate products like wound dressing and surgical adhesives, and USP Class VI, the strictest classification, which involves in vivo testing. Passing these standards ensures that adhesives are both effective and safe for direct human use. Manufacturing requirements for skin adhesives are just as critical as the adhesives themselves. Products intended for hospitals or wound care must often be manufactured in clean rooms where particle levels, humidity, and temperature are tightly controlled. The environment ensures that adhesives remain sterile and safe for medical use. Manufacturers may also need certifications such as ISO 13485-2016 for medical devices or ISO 9001-2015 for quality management. Strauss converts and die cuts adhesives in an ISO 7 clean room to reduce contamination and meet strict industry requirements, ensuring that products are both reliable and compliant. Finding the right adhesive for the intended wear duration depends on how long the product needs to remain on the skin. Short-term applications may rely on gentler, repositionable adhesives, while long-term uses often require stronger, water-resistant materials that can withstand extended contact without damaging the skin. The safest way to select an adhesive is to test it under real-world conditions, ensuring it performs as expected for the specific application. Wear duration, patient comfort, and removal safety are all factors that must be evaluated before moving into large-scale production. A converter can help find a material, test prototypes, and help design your part and bring it to life. If you want to learn more about how working with a converter can help your stick-to-skin application, feel free to visit our Learning Center or reach out to us directly. Thanks for watching.